right, hi everybody. I am now going to do my presentation on childhood obesity and national epidemic. I'm going to leave my toolbar open up here just so I can make sure that I zoom in and you can read everything as we go through it, and I can have the opportunity to zoom in if I need to. So starting over here in the introduction, childhood obesity affects more than 12.7 million children in the United States, and that's according to the CDC. Partially because the advancement of technology has led to a lot of really good things, but kids are not playing outside like we used to growing up in the 70s and 80s. We didn't have a lot of TV, we didn't have a lot of video games, so we were always outside getting exercise, and we didn't really ever have to worry about getting as much exercise as kids today, because that's what we did. Just going into a little bit of background, we're going to be over in this area. According to a study in JAMA Pediatrics Journal in 2014, it's not really news to anybody, I don't think. If you've watched the news or you've just been out and about, you know that childhood obesity is on the rise. So this study found that there was a significant increase in children who had a severe form of obesity where their BMI was 120 to 140% higher than children of an average weight. That is huge, huge. So the Centers for Disease Control found that children of low-income families are at higher risk to becoming obese than children of higher-earning families. So one of the reasons why, when doing this, I said, well, why are people going to care about this? Why do nurses care about this? Why should nurses care about this? Well, one of the biggest reasons is because studies show that obese children leads to obese adults. So if you're just getting started in your nursing career, the children that are, 5 and 6 years old today, in the middle of your career in 20 years, these are going to be the people we're going to be seeing. The diabetics, the heart disease, the MI, at a very young age. So a recent article in Time magazine showed data from a study in the New England Journal of Medicine, and it suggested that obese children may become obese adults. So they did this study, and it tracked over 7,000 children. And the children were of normal weight. They had children who were considered obese and those who were severely obese. They tracked these kids over 10 years. So what the data showed was that 14.9% of the 5-year-olds, these kids started as 5-year-olds, that were overweight in kindergarten, they were 4 times more likely to become obese nearly a decade later than 5-year-olds of a healthy weight. So those kids that, had a rough, obese kindergarten, they're way more likely than an average sized child to become obese 10 years later. So the more obese children and adults we have, the more chronic health problems we as nurses will have to encounter. And that's what I was talking about earlier, that we will see these things over and over and over. A lot of them are modifiable lifestyle factors. So the Healthy People 2020 objectives right here, I picked the ones that pertain the most to childhood obesity, which are nutrition and weight status, access to health services, physical activity, and health-related quality of life and well-being. So for each of these, nutrition and weight status, pretty self-explanatory. Access to health services, very important. A lot of these kids that are in a lower income community and family, they just don't have the access to health services and preventive services like those, I'm going to zoom in here, children who make a little bit more money. They have the money to go and seek outside resources and care versus, having to wait until the end of the month or till payday to be able to go to the doctor, to get a physical, and to buy healthy food. That kind of goes into health-related quality of life and well-being. If you don't have the money to buy fresh fruits and vegetables, it's cheaper sometimes to buy a bag of chips or buy the canned food off the shelf. It's a little bit easier, not as healthy. So for the needs assessment for this project, I conducted several interviews and did multiple surveys. So the surveys were given to parents, stakeholders of the community, and children, and questions focused on the perceived barriers to access to health services, physical activity, and healthy nutrition choices. I offered this surveys in both English and Spanish, and they were translated in person for parents who couldn't read. So a lot of the parents that I encounter on a day-to-day basis, they are immigrants. They do not read English. A lot of them don't read Spanish. A lot of them have, maybe a first or second grade education themselves. So I made it as easy as possible for them to be able to get the information. So the questions for parents was how they perceive their child. Do they perceive their child as being overweight, normal weight? What's their activity level? What is their screen time? How often do they sit in front of a television screen and things like that? The same questions were asked of the children. How did they perceive themselves? How active did they perceive themselves? And if they had a hard time finding healthy food choices. The theoretical framework and model that I chose was the Betty Newman Healthcare Systems Model. And I put this drawing right here I found on slideshare.net. And I think it's a pretty good example of the Betty Newman Healthcare Systems Model. So we talk about primary prevention, secondary prevention, and tertiary prevention. So for childhood obesity, I felt like we kind of cover all of them in my presentation that I did for my teaching. There were people who had children who were considered a normal weight. So I think that is a primary prevention. It happens before the problem occurs. For some of them, it may have been a secondary intervention or secondary prevention due to their children already being overweight or obese. And then tertiary interventions or prevention will be or was given for anyone who maybe has lost weight or is already trying to maintain a healthy lifestyle. So this also, the Betty Newman model goes into prevention, treatment, and maintenance of wellness. And it focuses on interpersonal and intrapersonal stressors that can misalign the body and cause health problems. So anything outside influences or just, personal stressors can affect one's health. Issues, education, and practice. Access to fresh fruits and vegetables, preventive care, and regular exercise are a vital key to preventing childhood obesity. We already talked about low-income families having a higher incidence of obesity than their higher-earning counterparts. And some of the barriers that exist in obtaining these key components include living in an unsafe neighborhood for outdoor play and exercise, lack of transportation to be able to drive to doctor's appointments for preventive care, location of grocery store that stocks fresh merchandise, and the inability to afford fresh food items. I found a picture that kind of depicts some of the stores that are available in the community that I'm doing my teaching in. And a lot of them are just mom and pop on the corner shops. There's nothing fresh in them. It's all prepackaged food. It's soda, chips, candy, things like that. And, you'll find bread or tortillas, sometimes peanut butter, but it's very, very basic. There's nothing about it that is makes it easy for people to be able to get fresh food. And, I did have parents say the only exercise their children get is at school because they know it's safe. They don't allow their children to play outside because it's not a nice neighborhood. It's not necessarily the safest neighborhood. So that is definitely a barrier. For the intervention for this project, I was able to conduct a teaching project for a group of parents and children, and I used a PowerPoint presentation. I did talk about the Healthy People 2020 objectives, nutrition and weight status, access to health services, physical activity, and health-related quality of life and well-being. So I was able to identify many local services that assist the families in obtaining health care, preventive services, obesity management. We also talked about the Fuel Up and Play 60 campaign that urges children to play and exercise for at least 60 minutes a day. And the school that I am volunteering at, they have a program called Move and Groove. And this is a program that was started in an effort to get kids and families moving more. So they do it once a week. It's a structured exercise program every Wednesday, and the kids and their parents can come in the morning before school starts and exercise. So it's been a great thing for the school. This group of families, I feel they learn best by explanation, and then I think they follow example. So leading a healthy lifestyle is very important, and I think it creates a trusting environment between the nurse and the parents. Budget and logistics. The budget for my intervention was very small. So it was less than $100 for all the supplies, the paper, the copies. The Move and Groove program has been implemented, and it doesn't cost anything because students and parents utilize school grounds for exercising. There's nothing additional that we needed to maintain and start this program. When I was thinking more globally, as far as in the community, budget and logistics, it would be in the millions to be able to create a perfect scenario where there was a grocery store within walking distance for our families to be able to go. So, that is something a little bit bigger than what I am able to do. But, it is something that I feel is an issue that can and needs to be addressed with our community stakeholders at some point after finding out information about what people want and what is available to them at this time. So project evaluation, design, outcome, and measurement. So the goals for this project was to educate parents on the importance of a healthy diet, proper exercise, and determine access to preventive care for obesity. To create an exercise program for children and parents in the community to increase physical fitness and decrease the chance of obesity. And to organize an ongoing educational program that will introduce children to new healthy food choices. Evaluation will be measured by pre- and post surveys for all participants, collect data on participants in exercise and healthy food classes, such as height, weight, BMI, and overall satisfaction of the program. And long-term goals can be measured by weight reduction, increased access to preventive health care, and a decrease in obesity-related maladies. So for this one, a lot of what I'm doing right now is building trust and creating a trusting environment with my parents, between myself and my community. So trying to start this and maintain this in the future, I think it will be an excellent program for our kids and our families. At this point, just being able to be a role model and be a person that has some of the answers and be able to present things that are in a straightforward and friendly manner is very important. So results and conclusions. Obviously, childhood obesity is no doubt a nationwide problem. Educating parents, children, and communities on the importance of a healthy lifestyle will decrease health complications related to obesity and inactivity. Weaknesses of the program were mainly related to a language barrier between myself and my audience. I speak a little bit of Spanish, but not enough, so I had to rely on a translator to translate the information for me. So that was the biggest barrier that I had to overcome, was trying to still create a trusting environment when I didn't speak the language. For future interventions, I will definitely need the help of a translator, and it would be helpful if my translator was familiar and comfortable with this community. And, for me, my translator is an LVN, so she has some medical background, and she has a lot of medical knowledge, and she was able to assist me a lot in translating and putting things in a way that people understand. So overall, I think this was a great project. I think that my families were eager to hear some new information, and they were very eager to learn. And it gives me some places to build on as far as things to do in the future. Thank you for your time. I hope you enjoyed my presentation.